Hi all, I'm Dr. Pavitra and I think it's enough of a break that we had for the past 1 week or so, and I think we should get back to academics real fast and real soon. So today's topic of discussion is going to be ethics in biomedical research. This was asked in the recent DNB June 2020, which was conducted in September. So let's get into this topic. This is sort of a dry question, if you want to put it at that. What is it actually about? See, ethos means moral. Moral is the inner compass that you have and which says what you are doing or your motive is good or evil and whether it is right or wrong. And it's okay to have conflicts of interest whenever you are doing something, but the way you deal with it is going to decide whether you are doing it in a moral or immoral way. And with the advancements of medicine, you are going to have to do newer research, newer projects, and with that comes new situation. And with every new situation, you have dilemmas, you have controversial ethical issues. The controversial ethical issues as in whether what you are doing is right, whether how you are doing is right, and on whom you are doing, is that okay? So all of those questions needs to be answered, and that is bioethics. If you see, there are so many guidelines as to which defines how a research should be conducted, especially on humans, okay, and all of them have these 4 basic principles. They are autonomy, non-maleficence, beneficence and justice. Let's see what they are. Non-maleficence is do no harm. See, even if you cannot help the patient anyway, do not harm them. Beneficence is you giving them the benefit by doing something or preventing harm. Autonomy is giving the patient the ability to make the decision for themselves. How do you do that? You give them the options of treatment or investigations and let them decide on their own after a proper information that is given by you. Justice is you treating every patient the same irrespective of the patient's caste or culture. You may have your own bias, you may have your own restrictions or reservations about certain groups of people, but that should never interfere with you treating a patient, okay? Every patient is the same. They have come to you for treatment and that is all you are going to do. Few other principles are veracity, fidelity and confidentiality. Veracity is you giving the information in an understandable way, in a language that they can understand, in their own native language is preferred. Fidelity is you trying to meet the patient's reasonable expectation. And confidentiality is, as the name suggests, you keep the information that is provided by the patient confidential. Try not to discuss it with other people who are not actually involved in patient care. There are multiple theories of ethics, okay. This is just for interest sake, I liked the theories part. One is deontology, consequentialism and utilitarianism. What are these? The names look very fancy. So if you see, deontology is nothing but, see, you do some action based upon a motive and you have a consequence. The consequence can be good or bad, or it can have no effect. It can be any outcome. But if your motive is good, then you have good ethics. That is deontology. So deontology basically deals with the motive. Consequentialism, on the other hand, irrespective of what motive you have and what action you do, if the consequence is good, then you have good ethics. And if the consequence is bad, then your ethics was bad. Okay? So consequentialism deals with consequence, deontology with motive. Utilitarianism is you doing the greatest good for the greatest numbers. Does not matter what motive, does not matter what action. If most of the people are benefited, then you have a good ethic. So why these many theories, why these many, why are we talking about this basically? That's because in the past there have been multiple inhumane experiments. I think we all remember the Mengeles experiments on twins, where one of the twins served as the control and the other as case, and too many cruel investigations were done on the children, and that is not acceptable. So hence in 1947 something called as the Nuremberg Code was started. And from then on there have been multiple guidelines including our own ICMR, I think in 2006. So all of them have come with guidelines for human subject research. First you ask whether the research is necessary at all. Okay, principle of essentiality. Do you need to do this research? See, if the answer is already found, what are you trying to achieve? You have to try to find something new, or new, you can put it as new. It can be a new treatment, it can be a new investigation, it can be anything, but it has to benefit someone at the end of the day and not repeat what has already been done. And suppose the research is necessary, then you are going to recruit people, correct? So the people recruitment should be on a voluntary basis. You don't pull them into research involuntarily, forcefully, and it should always be by informed consent. Informed consent should be given to the participant. If the participant is underage or incapable of giving you a consent, then a caregiver who is the legal guardian will be giving the informed consent. Okay. And informed consent should also be non-exploiting, in the sense both the plus and minus of the study should be explained. Suppose you expect some adverse drug reaction from the drugs, you should mention that despite you thinking that it will give a positive effect for whatever disease that you are treating. Understood? So it should have both plus and negative. That is theory or principle of non-exploitation. And you should always have a mechanism for compensation. You can give them directly like money, and rather than that nowadays it's insurance cover for the study. So all of these should be done, and informed consent should preferably be done in a native language, and rather than getting signed as informed consent, it should be a sign that they have understood whatever you have told. That will be a better way of doing it. And after doing everything, the patient information that you collect should be private and confidential. Next, how should the person who are conducting the study be? They should be competent, they should know the risk minimization, meaning whatever they do, it should be at the least risk possible. Okay. And there should be accountability and transparency. Whatever is happening should be informed to everybody. Alright. It should not be hidden just for the sake of getting out a good study paper. Maximization of public interest. This means that whatever the results you get, suppose you have a X drug that is really good. You want this X drug to be available to everybody. Okay, not just people who are big shots and have too much money. It should be available to all of the population. So that is maximization of public interest. Then you should have institutional arrangements, as in for saving the data, for saving whatever study you have done, all the details, it should be in a safe space. Then you will publish your results. You will publish your results in public domain to be available to all, and you should have principle of totality of responsibility, meaning you should say who has conducted the study, if there has been a funding, if so then who has funded it, where was the study conducted. All of those should be done, and the person who is conducting the study is going to take the totality of responsibility. Okay. And to make sure all of these principles, whatever I told now, this is not just a story, actually everything is a principle. Principle of maximization of public interest, principle of institutional arrangement, principles of public domain. These are all ICMR recommendations for biomedical research ethics. Okay. So to make sure all of these are done properly, you have something called as Institutional Review Board, IRB. Okay. So there will be a group of members who belong to multiple categories. There will be doctors, there will be social workers. So all group of people, usually 7 to 8 people will be there, and especially research on human subjects will be analyzed by them to make sure they are done in an ethical way. So I think that's all about ethics in research. If you know this much, it's more than enough for you to write a small short note and understand what you are going to do if you are going to do your thesis. All the best, guys.